Community Analysis of Downtown St. Pete with Colleen, Jessica, and Nicole. St. Petersburg first came to the scene in 1875. General John Williams of Detroit first bought 2,500 acres of land on Tampa Bay. The Gandy Bridge opened in 1924, making it easier for people around the Pinellas County area to commute to the St. Petersburg area. Downtown first began to flourish into how we know it today in the 1950s. Streetcar tracks made way for the modern automobile, and the population reached over 200,000. The city continued to flourish in the 2000s as the development of Baywalk offered residents more options for upscale dining and shopping. Today, the city is home to the Dali Museum, the Dale Chihuly world-renowned glass collection, and 6 art districts. Hosting over 900 events a year, St. Petersburg continues to thrive as an urban city.
The residential community of downtown St. Petersburg is an urbanized blend of apartments, condominiums, and business establishments. From street to street, you can find an apartment complex alongside a restaurant, art gallery, clothing boutique, theater, or brewery. The fact that the city is a waterfront community makes this a desirable location. It is evident that the city is doing their best to adequately meet the needs of the community by the amount of construction that is underway in the area. The population has grown by 36% in the last 10 years, reaching 10,000 residents in downtown St. Pete alone. Currently, there are 880 housing units under construction, and where there once was a small duplex, hangs a sold sign with architectural designs of a bigger complex to go in its place. You can find this every few blocks. There seems to be a continuous fine line between housing needs and the growing population, and it's worth an area of concern. The city offers one low housing option in downtown St. Pete named the Jamestown Apartments and Condos, but recognizes the need for more. In an effort to expand, the city launched the Rental Rehabilitation Program, a plan to remodel several rental properties and offer it to low and moderate income families in the area. Additional parking garages and funds for Pinellas Habitat for Humanity were some of the issues that were discussed in the downtown community meeting. Additionally, there are 8 shelters that offer homeless and transitional housing, as well as 5 Christian churches that offer support groups, food pantry, and donate monies towards the homeless. There are numerous options of getting around in downtown St. Pete, including the trolley system that provides free service around the beautiful waterfront. There is a local bus depot that can connect to any bus anywhere in Pinellas, including the beaches. There are rental bikes that can be picked up and dropped off in various locations, and downtown St. Pete has been named one of the most walkable cities, but with the numerous construction zones, many of the blocks have detours for cars and pedestrians, leaving walkability a potential safety concern. Downtown St. Petersburg holds 3 of the largest hospitals in Pinellas County with state-of-the-art technology and innovative medicine. Bayfront Health of St. Pete, St. Anthony's Hospital, and Johns Hopkins All Children's Hospital are located within a few blocks from each other. The median age for downtown St. Pete is 49, and it appears to be an educated, working community. A majority of the residents have their bachelor's degree, are employed, and meeting middle-income brackets. With 69% of the population primarily white and 24% black, downtown St. Petersburg seems to lack racial diversity and culture in Hispanic, Asian, and Native American races, and could potentially lead to misunderstandings, racism, and prejudice related to cultural incompetency. Identical to nationwide disease reports, chlamydia and gonorrhea are the 2 top communicable diseases in St. Petersburg, with 5,000 cases reported each year. Protection against STDs should be focused on high-risk populations such as sexually active individuals under 24 years old. Lung cancer, secondary to smoking, is the #1 killer in St. Petersburg. The risk increases with age and is considered to be a disease for people over 60. Smoking cessation can decrease the risk, and the population of downtown St. Petersburg should be a target group for education. Nationwide, ischemic heart disease is the #1 killer, but comes in close second in St. Petersburg, related to poor diet, obesity, and inactive lifestyles. Individuals should be educated on the healthier food choices in local restaurants and the health benefits of local recreational activities in the area.
Hospitals in the area include Bayfront, St. Anthony's Hospital, and Johns Hopkins. The American Family Care Urgent Clinic and the St. Petersburg Free Clinic offer cheaper options for those without private insurance, Medicare, Medicaid, and people who do not qualify for low-income county health care that are in need of health care. The Holistic Mental Health Clinic is a clinic located in downtown St. Pete that specializes in natural treatments for mental health, focusing on mind, body, and spirit. The Weirwick is a unique resource because it is an adult living facility with a specialty license and limited mental health services. Financial assistance is available at the facility through the Department of Elder Affairs. Right at Home is a home health and assistance program offered for seniors in the St. Pete community. The nurses and care techs help patients in the comfort of their own home. Pricing depends upon insurance coverage. Baycare Urgent Care helps patients in the Northeast St. Pete community with minor injuries and illnesses. Cost determines the type of insurance coverage your medical plan covers. Bayside Care Center helps patients in the community with short and long-term rehab and skilled nursing care needs. Pricing of these services is dependent upon insurance. The cost of health care without insurance can make it less accessible and less affordable. However, the St. Pete community offers a wide array of healthcare services to meet the needs of all the community members. Healthy People 2020 prioritized objectives. Number 1, C1, reduce the overall cancer death rate. This is important to the St. Pete community because cancer is the number one cause for death in the community, accounting for 22.8% of mortalities. Number 2, STD1. Reduce the proportion of adolescents and young adults with chlamydia infections. This is important for the St. Pete community because chlamydia is the number one communicable disease, accounting for 55% of communicable disease infections. Number 3, IID1. Reduce, eliminate, or maintain elimination of cases of vaccine-preventable diseases. This is extremely important due to the fact that St. Petersburg is still growing as a city and people live within close quarters to one another.
From the numerous parks, sanitation regulation, and hard-working police force, I would say downtown St. Pete has adequate resources for their community members to feel safe. North Shore, Vinoy, Williams, and Albert Wooded Park are all public parks in downtown St. Pete. Parks and communities are very beneficial to overall health and help lower the risk of diabetes, heart disease, and chronic respiratory problems. Parks improve overall mood, decrease stress, improve mental health, and increase productivity. St. Pete offers a once-a-week trash collection service. Since 2015, St. Pete has reduced the amount of trash sent to the landfill by using the city's new recycling program. This recycling program has helped Pinellas County achieve its highest rate of recycling statewide. The City of St. Pete Sanitation Department can assist residents with free rodent control on the outside of their property or in local neighborhoods. While performing the windshield survey, I observed many community members biking with no helmets. According to the Florida Department of Transportation, it is Florida's goal to create an environment to ensure safe biking and increase awareness of bike safety. Due to 24 pedestrians killed in 2017 and increased pedestrian accidents, it is the goal to make downtown St. Pete a safer environment for everyone. Homelessness has become an ongoing problem in downtown St. Pete. To help with the homeless population, St. Pete has an initiative program called the Power of Change Homeless Program. This program uses parking meters to raise awareness about the homeless and give community members the option of donating money to programs that help the homeless instead of handing out money on the streets. So far, the city has raised over $6,000 to help the homeless in the community. Rick Kreisman was sworn in as the 53rd mayor of St. Pete. Mayor elections are held every 4 years, and this is Rick Kreisman's second term as the mayor of St. Pete. Dr. Kaylin Tomlin is the deputy mayor of St. Petersburg. She works in partnership with Mayor Rick Kreisman to improve the city towards its goals. Reaching out and speaking with Deputy Mayor Tomlin, she is enthusiastic about the direction of St. Pete and is optimistic about the future plans of St. Petersburg. The Board of County Commissioners has the power to adopt local laws, approve of county budget, and establish the requirements for the departments. There are a total of 8 county commissioners that work with the City of St. Pete. The City Council members working with the area of downtown St. Pete are District 4, Darden Rice, and District 6, Gina Discroll. City Council meetings are held 3 times a month in City Hall. Meetings can be viewed by the public on cable TV or live web stream online. St. Petersburg is currently under a lot of construction for benefit of growing the community, but this can also come at a financial cost to the community. A new police headquarters is being built that is costing the city $81 million, and it is expected to be completed by the end of this year. The City Council just approved the $46 million Pier Park project for building the new pier. The project for the new pier is in design, and it is expected to be completed by the end of this year. Johns Hopkins All Children's Hospital is constructing an $85 million research facility located in downtown. The Museum of American Arts and Crafts Movement is under construction and costing $70 million. After the construction of the museum is complete, it will make this museum the largest museum in Tampa Bay area.
Prioritize community needs of downtown St. Petersburg. Number 1. Sexually transmitted disease accounts for roughly 86.2% of reported communicable diseases in St. Pete. Sexually transmitted diseases caused by viruses cannot be cured and result in chronic disease and a lifetime management of symptom control. Number 2. Heart disease. Although cancer is the leading cause of death, accounting for 22.8% of deaths, heart disease is not far behind with 22.7%. Unlike cancer, heart disease has more modifiable risk factors that can be avoided by the community. Number 3. Poverty. Approximately 16.4% of the community is below the poverty line. Poverty directly affects health and well-being, leading to higher rates of chronic disease, higher infant morbidity and mortality, shorter life expectancy, and more complex health problems. Number 4. Unemployment. Approximately 4.5% of the downtown St. Pete community is unemployed. Individuals that are unemployed are less likely to have health insurance. An individual that does not have health insurance is less likely to see a provider and less likely to seek health care when needed. Number 5. Crime rate. There were a total of 1,727 violent crimes committed in St. Pete in 2016. The potential for violence against individuals is directly related to the level of violence in the community. Number 6. Education. Only 29.4% of the population has an associate's or bachelor's degree. Advanced degrees give workers an advantage in obtaining rewarding jobs that offer not only higher salaries and job satisfaction, but other health-related benefits such as health insurance. The community needs were prioritized in relation to impact on overall health and well-being of the community and statistical data.